The day of my retirement is the day we started going camping. We have had a kind of a dream for some time. We had some friends that had an RV, and we went with them, on a trip one time, and we just said, well, that's something we would want to do. We decided to sell our home, so we we kind of rolled up the carpets and left, and we've been going ever since. From what I remember was that we made burgers and we were sitting outside, jolly, and then we went inside and I started my hand went numb, my legs started to go numb, my mouth was starting to droop and full on symptoms.
I've seen what happens with strokes, so if it happened any later, I would have probably already been in bed, and I wouldn't have heard him because he couldn't talk to me.
She thought it was a stroke, so she was right on top of it. She called 911, and they got there so quick, I couldn't believe it.
As soon as the EMTs got there, it was just so fast, and I knew that it just started, so I knew that we maybe had a chance.
In stroke, we talk about time is brain. That's a mantra we live by. But we have a lot of evidence about the golden hour, meaning that in patients after symptom onset, if we can deliver treatment within 1 hour, that medication that dissolves blood clot, it is much more likely to be effective in the first hour. The paramedics recognized that this was a severe presentation of stroke, and therefore they bypassed other hospitals that were potentially closer and brought them directly to a comprehensive stroke center. Lights and sirens right up the highway to Mayo Clinic here in Jacksonville, and because of that, we were able to very quickly identify what the problem was with the CT and a CT angiogram. We were able to see that there was a small blood clot limiting blood flow to his entire left cerebral hemisphere, and we were able to administer the drug about as quickly as we can.
They gave it to me right there on the table, and it was a miracle drug as far as I'm concerned. It definitely saved my life. I'm truly blessed, to be honest, that all of these things, came together the way that they came together, and that Mayo had the clot-busting drug and the experience, the knowledge. They moved really quickly in the emergency room. It really is. It's a miracle.
To see it all happen and to see somebody then immediately after treatment moving, talking, speaking, and recognizing and seeing their loved ones and being able to say, I love you, and say the things that they want to say, those are those situations that will stick with you, because those are the cases that you dream about as a stroke neurologist. When we think about EMS education, I always think about my parents, right? They could be anywhere in Florida or in the United States, and we really want to raise the floor of all EMS so that anybody who has a stroke is able to get comprehensive and fast stroke care. Everything we're doing is ultimately to make sure that each patient has the best chance of a good, meaningful outcome in terms of getting them back to the person they were before the stroke.
If Mayo Clinic had not been here to take care of him, and the EMTs in this community, our whole family would have lost a lot. I'm very blessed that Mayo Clinic was here and everything fell into place, and I'm now looking forward to the many more years to come that we've been given from Mayo Clinic.